In normal times, they have 4, maybe 5 burials a day in this Lusaka cemetery. But Zambia is in the grip of the 3rd wave of COVID-19. Now they have 5 times that number, day after day.
We bury the doctors, we bury the nurses, we bury mother and father, we bury parents and child. So it's extraordinary how many people are dying, within a family. Someone dies, the day of the burial, someone else dies.
For a long time, it seemed as if they, like many other African countries, had escaped the ravages of the virus. But even if that were true then, it isn't now. Do you think that there are more deaths, for instance, than are being reported?
That is very possible because, as you know, that in our countries, we don't have enough capacity to test almost everyone who falls sick and also to test every death. Certainly, we did what we call a mortality surveillance, where we're swabbing cases that were brought in dead at the health facilities, and we found that quite a number of those were due to COVID-19.
This is a video put out by the Zambian Ministry of Health. Yet what we know from health worker testimonials is that the mortuaries are full, the hospitals are full, there isn't enough oxygen nor PPE, and only 10% of patients ever make it to a health facility in the first place.
One doctor services as many as over 9,000 people. That's the current ratio. And with COVID-19, it's now over a year and a half, and healthcare staff are overwhelmed.
There is an election in Zambia next month, and with it, accusations that the government is cracking down on people speaking out about the COVID response. But these are some of the messages we have received from healthcare workers.
We are losing doctors, and it's scary and painful. We are tired and speechless.
Without the vaccines to reduce infection rates, or at least reduce the incidence of severe illness, we will be utterly overwhelmed by this, and we will not win.
I've walked away from patients because I can't do anything. If there's a drug we need, it's oxygen.
These are indeed desperate times for a country like Zambia with an already struggling healthcare system. God help us.
They need vaccines here, as they do across Africa. And this week a shipment arrived in Zambia, a donation by the United States, part of a 500 million doses pledge made at the recent G7 summit. The UK also promised 100 million doses, but the Foreign Office failed to answer repeated questions from Channel 4 News about whether any of them have been shipped.
Vaccines need to be in people's arms. So when you sit down around G7 and say we are going to give 1 billion and then we give them in a year, what about the people who die because they haven't had vaccines? Who takes responsibility for those deaths that will happen before the G7 sends its doses? It's not about doses, it's about timeliness. This is an emergency. And I think this is the message you must send, that a vaccine delayed is a vaccine denied. When you give it to me and I'm dead, it doesn't help me.
And now they are comparing COVID to HIV. A generation was lost then, and it's happening all over again with the ripple effects of so many deaths that will be felt for many years to come.